Okay, good morning everyone and welcome to University of Manchester for the MAHSE STP Open Day. So if that isn't what you thought you were here for, you may leave now, but hopefully as you all registered, that's exactly why you were coming today. My name's Carol Ainley. I'm the Deputy Director of MAHSE. So I'm going to start the proceedings today, and then we have colleagues who are going to speak to you. Probably the ones you'll be most interested in listening to initially will be the students who either are currently on the programme or have completed the programme. And then you also get to talk to the different programme leaders about what's involved in the different specialisms. Okay. So what are healthcare scientists? Healthcare scientists work in a multitude of different disciplines in the NHS and in the private sector. They provide diagnostic advice. So they may be working in a laboratory, testing a blood sample or a piece of tissue. They may be working with patients, undertaking an ECG, testing your neurological responses. You could be working with medical devices, in medical physics. A whole host of different disciplines are encompassed with the term healthcare science. Healthcare scientists make up approximately 5% of the NHS workforce. So they're not a major number of the workforce. As you might expect, the majority are going to be doctors and nurses. However, healthcare scientists are involved in 80% of diagnoses on patients, and those diagnoses are then involved in the treatment development plan. So they're very, very key players in the NHS and in the patient pathway. There are 51 different disciplines in total, and they make up the largest scientific workforce in the UK. So hopefully you knew most of that, and that's why you're interested in applying for the scientist training programme. On the next slide I'll talk about all the different careers in healthcare science. But for the scientist training programme there are 4 major areas where you can apply to take a training post in different disciplines. There's the physiological sciences covering neurosensory, cardiac critical care, vascular science, sleep science, respiratory science, GI physiology, physical sciences, medical physics, clinical engineering, pharmaceutical science and reconstructive science. In the life science we have the disciplines within cellular sciences, blood sciences, infection sciences and genomic sciences. And a relatively new area of healthcare science is clinical bioinformatics. And that includes genomics, health informatics and the physical sciences. The government set up a team called Modernising Scientific Careers to look at the career pathways for the different scientists within the NHS. And they wanted a career pathway that meant you could enter with any level of education and eventually, with a lot of hard work and a lot of time, work your way up to become a consultant healthcare scientist. So the majority of people enter the profession either as a healthcare science practitioner or as a healthcare scientist. So that's on the practitioner training programme or the scientist training programme. You can progress from the practitioner training programme onto the scientist training programme, or you can become a graduate in other disciplines, biology related, and apply for the scientist training programme. Okay. Scientist training programme itself is a 3-year, quite intensive programme. It consists of academic education and workplace training. For the academic component, you will undertake an MSc in clinical science, and that will be in the discipline in which you're employed. So if you're successful in attaining a place on the scientist training program in reproductive science, you will eventually get a degree, an MSc clinical science in cellular sciences, reproductive science. Only selected universities can deliver these MSc programs. The universities have to tender to be allowed to deliver, and for a vast amount of the programs, there is only one university in England who is able to deliver this for the NHS. For other programs, there are two, possibly. In fact, no, I don't think there are any where there are 3 universities now. It is a Health Education England initiative, so it's why we talk about universities in England. Doesn't mean to say if you're Scottish, Welsh or from Northern Ireland, you can't apply to go on the scientist training programme. We also have people working as scientists in those areas of the UK who will attend the universities in England to undertake the academic component, even though they're not on the scientist training programme. A rough split is that you will spend 20% of your time on your academic study. That doesn't necessarily mean 20% of your time at university, and 80% of your time on your work-based training. All of the clinical science programs follow a similar pathway. In year 1, you will study 60 credits of material. 20 of those credits are generic material, 40 are divisional. So if we go back to the example of cellular sciences, if you do get a place on the reproductive science programme, you will, in the first year, study 20 credits of generic material, which is about professionalism and general science, ensuring everyone, no matter what your background, is going to be studying at the same level. And you will study 40 credits directly related to the different disciplines of cellular science. So that will be some reproductive science, but it would also be some histology and some cytopathology. Hopefully you're successful, and you're successful in the OLAT, the work-based training as well, and you progress into your second year. In your second year, it's a 30-30 split. 30 credits are working towards your research project, and 30 credits are of specialism. So if you are that cellular science, reproductive science trainee, in the second year, your specialist material will all be about reproductive science. It won't be about histology and cytopathology. And then it's similar in the third year, and it culminates with you submitting your thesis for your research project. As I said, there are different universities that are involved in delivering these MSc programs, and how the material is packaged in the different universities will vary. So in year 1, it won't necessarily be one unit, one module of 20 credits of generic material and one module of 40 credits of divisional material. It may well be packaged in a different way, but ultimately everyone will be covering the same material within a specific discipline. The National School of Healthcare Science, you will hear mentioned quite a lot today, because they are key in the recruitment and delivery of the scientist training programme. They're there to support you as trainees throughout the programme. So throughout the 3 years, they support the department that you're working in, they support the staff that are delivering the training to you in the workplace, and they also help to resolve any issues you may have with your academic study. Because there are a number of training departments involved and a number of different universities, the National School helped to maintain the standards and the consistency. So that means if someone comes to the University of Manchester to study MSc Clinical Science Biochemistry, they're going to end up with the same standard of qualification and be educated and trained to the same level as someone who may go to the University of Birmingham to study MSc Clinical Science, Blood Sciences, Biochemistry. The National School are there for you, so if you are successful and attain a place on the training programme, you do need to get to know whoever the specialist is at the National School in your discipline. We also have the Academy for Healthcare Scientists who are involved in the scientist training programme. They provide a professional voice for all disciplines of healthcare science. They ensure the standards and the quality of education and training. So the National School developed the curriculum, but it's signed off by the Academy. So for example, within the National School, you may have someone developing the curriculum for blood sciences, someone completely different developing the curriculum for cardiac science. But ultimately, the standard of education and the standard of training, the output in the form of the scientists, need to be at the same level. So the Academy are involved in ensuring that consistency of standard and quality. So you shouldn't have a cardiac scientist who graduates from the scientist training programme and is at the level of a healthcare science consultant, because they should be at the same level as that biochemist that's graduating. Okay? The Academy are also very key in negotiating with the government and in raising the profile of healthcare scientists throughout England and throughout the UK. Okay? I said earlier, only 5% of the NHS workforce, but involved in 80% of diagnoses. So it's really important that people understand who healthcare scientists are and the role that we play in the patient pathway in treating their disorder. So what is MAHSE then? So far everything has been fairly generic, but you have come to the Manchester to the MAHSE presentation to find out about the STP today. So MAHSE is the Manchester Academy for Healthcare Scientist Education, and we're a cross-university body. When the government asked universities to tender to deliver the clinical science programmes, we realised in Manchester that there were strengths at different universities, and that actually by combining those strengths, we could give the best possible student experience for the programmes that we deliver. We encourage the sharing of good practice, we encourage innovation in education across the 3 universities that are primarily involved in MAHSE and our affiliate partners. We support and develop students who are on the practitioner training programme, the scientist training programme, and also on the next stage of the career pathway, the higher specialist scientist training programme. Clearly, we only support those students who are on programmes that are delivered in Manchester, but you may be employed in Southampton and coming to Manchester for your MSc, okay? And of those STP themes, we deliver 8 of them. Neurosensory, cardiovascular, critical care, respiratory and sleep, clinical pharmaceutical science, reconstructive science, clinical bioinformatics, genomic sciences, blood sciences, and cellular sciences. So as you can see, for the STP, we're involved in a large majority of those different disciplines of healthcare science. For the PTP, we're involved in the physiological sciences and the life sciences across the universities, and we at MAHSE hold the only tender for the higher specialist scientist training programme, so we're involved in all disciplines. So the three core university partners of MAHSE are the University of Manchester, Manchester Metropolitan University and the University of Salford, but we also have other partners who work with us on the different programmes, such as the University of Liverpool, UCL, King's College, University of Aston. For many of these, we are the sole provider. I mentioned earlier that in a lot of cases there's only one university. For some, there are other universities involved in the delivery, so completely separate delivery. So blood sciences, if you apply for the STP in blood science, you could be sent to Manchester to study, or you could be sent to the University of Birmingham. If you apply for the disciplines of CCVRS, so that's cardiac, critical care, vascular, respiratory or sleep, you could be sent to Manchester, or you could be sent to the University at Newcastle. And for neurosensory, depending on the discipline on the whole, but not entirely, you could be in Manchester, or you could be at Aston University. Okay? As we understand it, it's not necessarily your choice as a trainee, it's more the commissioner's choice and the preferred provider of the department who ultimately trains and employs you. So, applications for the scientist training programme. We have been told they will open in January. Applications are run by the National School of Healthcare Science, so you don't apply to the university. You apply to the National School, you go through a process in which the universities can choose to be involved, they can choose not to be involved, and if you're successful, you're then told which university you will go study at. You apply at that university, but that's kind of a given. You have to fill in the application form, but the university isn't going to reject you, because by being successful through the National Schools application process, we know you have the academic criteria required for the university. There's a link there for more information about applying for the scientist training programme. Okay, so I think we're going to leave questions until the end, until we've had all of the speakers. So I'm now going to pass over to Dr. Martin Stout, who's going to talk to you in more detail about the actual application process.
Okay, so I've only been given 20 minutes, so it's going to be a quick, really quick sort of run through of the application process. So, as Carol said, all the information about applying is on the National School website. So if you use the link that Carol has just shown, then most of the stuff that I'm going to talk about, you can find out all that information from the school website as well. Okay. So Carol's already gone through this pretty briefly. So it's a 3-year training programme. There's a clinical, which is a work-based element, and obviously the academic element, which is at the university. The whole point of the STP is to attract, select and retain the best sort of clinical scientists that we can in the country. Okay, and that is why it's such a competitive programme to get on. And to be honest, because it's such a good deal at the moment, it's basically a free master's degree and 3 years of paid employment for a direct entry, then the competition is absolutely massive. So obviously there's a lot of you in the room here now, but guaranteed there's hundreds of other people who haven't come, who will be looking at this on a daily basis and getting ready to apply for the programme as well. Okay, so very competitive, which is why I suppose coming here will possibly help you and give you a bit more of an insight into some sort of hints and tips and tricks that might sort of get you through the process, where those people who haven't bothered coming or didn't want to come won't have that opportunity. So, I presume, hands up if you've seen the advert already? Most of the room? Okay, so usually, and most commonly, what would happen is you would, once you apply to the programme and you get on the programme, you are given a temporary 3-year contract with an NHS trust. That is usually and should be paid at a band 6 salary, which is around about £25,000 per year. Okay. You will also get your academic fees paid for as part of the programme, so you won't have to pay for your own master's degree. That is currently funded for you already. So that sort of incentive is why it becomes competitive, because lots of people want to take the opportunity to get onto a programme such as this. This is important. Okay, all these documents are on the school website. There's a generic job description, there's lots more information. It's really important that you read them and you read them properly, okay? It's going to give you a massive insight into what the job entails, what you will be expected to do, what qualifications you might need to get onto the programme, what sort of person it is that we're looking for. And it's all these sort of qualities and this information that you need to bring out in your application. And if you get through to the interview stage, then you will need to refer back to this job description and this role so that the people who are interviewing understand that you understand what is involved in the job. So it's really important that you read it. It gives you loads of information, but it will, obviously you'll understand the role. It will tell you who you will be directly working with, okay? Some of you might be working with patients, some of you might not ever see a patient, you might be working in a lab, okay? It will tell you who your managers might be, your line managers, what other staff you might be involved in working with. So it's very important that you read it. It will give you your terms of service. So if anyone's like me, when you get your contract for a job, I never ever read it, well, you probably should do. You should understand what the terms of service are. Because if you're going into something that you're not going to enjoy or you're not happy with and you don't accept the terms of service, then it's going to be a problem. I believe, although I'm not certain, I might ask the two students, are you part of the NHS pension scheme? Yeah. So you will automatically be entered into the NHS pension scheme for your 3-year temporary employment. You are also eligible for all the NHS staff benefits, and this job description will tell you what they are. You might be able to get discounts of certain things and lots of other sort of benefits as well. But it's very important that you read through the document. There is also a core person specification, which you will find on the National School website. So this is perhaps where we need to go into a little bit more detail about what is required and what sort of person it is that we are looking for. And the first initial bit is the actual qualifications that you need. Okay, so you need to be really thorough in looking at what qualifications it is that you need to get onto the programme and make sure that you meet that criteria. So literally when we shortlist and we get the information, obviously we don't see anybody's name, it's all anonymised, but the first question is related to the qualifications, and do the qualifications match what is expected of someone at this level. So you can essentially be stopped at that point. If you don't pass that first initial bit, then there's no point in us reading the rest of the application form. Okay, so make sure that you meet those essential qualifications to get onto the programme. But it's not just about qualifications, there's loads of other skills that we're after as well. Okay, so all the scientific skills that you can, I'm not going to go through them, it'll take a long time, but if you read the document, then you will understand the scientific skills that we would expect a clinical scientist to have in the NHS. Okay, it's not just scientific skills, there's lots of other skills, so transferable skills, so your leadership skills, how you interact with patients, how you interact with other members of staff. So there's lots of different facets that you need to sort of understand and bring out in your application. Okay, and the way you understand them is just simply by reading through the document. Okay, and then aligning that to what it is you've done in your past, your experience, if you're doing a job now, what you're doing in your job now. Okay, does anyone work in the NHS already? Oh, quite a lot. Okay, so will you be applying as in service? No, so you're leaving your job and coming in this way, right? Okay, so certainly people who are working in the NHS now will potentially have some advantage experience-wise, because obviously they might have worked with patients, they've been in the environment, they understand the different aspects of the NHS. If you haven't worked in the NHS, then it's a really good idea that before you submit your application or you put on your application that you've arranged basically to go in to a department and look at the department, look at how a clinical scientist works, look at the different roles involved. If you know which specialism that you want to apply for, say it's, I don't know, cardiac science, then find your local cardiology department, phone them up, ask can you go in and observe. We do it loads at Wythenshawe Hospital. We have lots of people coming in and observing things and looking around the department. But that will give you a really big advantage when you, A, come to fill in the application form, but when you go to an interview, if you get that far, you can talk about your time in the cardiology department and the staff you've worked with, what you've seen, and you can show that you understand the role of the clinical scientist. There is a YouTube video, which I'm not going to play it because it's too long, but the link will be there, so you'll be able to sort of copy the link and you'll be able to listen to it yourself. But it was done by the North West Healthcare Science Network. I've done a video about the role of a healthcare scientist. It's very broad, it's not sort of specific to one particular discipline, but it gives you a good sort of background knowledge of what a healthcare scientist should do. So it'd be really good if you could maybe see the video on YouTube and have a look at that. Okay, so there's two ways of getting onto the programme. By far the most common way is direct entry. Okay, direct entry, it's dead simple. You apply to the programme, you get onto the programme, you're employed full-time, 3-year contract, it's fixed term, you get your salary at band 6, and then you get your academic component paid for as part of that deal. Okay. In-service is slightly different in the way that most in-service trainees have been working in the job for quite a while. Okay, they perhaps already work in a department. They've been identified or they've expressed an interest to their employer that they would like to do this training program. Okay, so if their employer is happy to do that, then they can stay in the job, carry on as normal. However, they will still be accepted onto the program. They would have to do all the same rotations and do all the same workplace elements as someone who's direct entry, but it's slightly different because obviously they're not leaving somewhere and coming into a new department. They are already in the department. Okay. The funding's slightly different as well for an in-service compared to direct entry. Okay, so there's disadvantages and advantages to both sort of routes. In fact, Sam, who's going to speak to you next, she's an in-service trainee, so she might be able to give you an insight into what it's like being in service in Kent is a direct entry, so you've got two perspectives there. I'm not going to go right through this, but all this information on the school website. So it basically says on the application form that you need a relevant degree. So to be honest, the question that comes up loads and loads and loads is what is a relevant degree for a particular specialism? Okay, so the school have put together a bit of a list, and to be honest, I've read through it, and there's still things missing off it. So for example, for the physiological sciences, there's a lot of stuff about physiology, different sort of degrees that might be acceptable for that, but I know loads of people who do cardiac science who've got sports science degrees. So as long as there is an element of physiology within your degree for that particular one, then you will be accepted onto the programme based on that. Okay, so just make sure your degree is relevant. So if you're doing a degree in, I don't know, gardening, don't apply to do cardiac science because it's not relevant. Okay, so just make sure that you read the documents. Okay, so how do you actually apply? Right, so as Carol said, it opens on Monday. I looked yesterday and it was still not open. So hopefully it will be open on Monday. If you go to the National School website, there will be a link on the website to the application portal, which is this Oriel system here. Okay, you have to register for it, then you sign in, log on, and then eventually you'll be able to see that page here. Okay, on this page it will have a list of all the different specialisms, and it will have a list of employers that are offering positions in their department. Okay, so you can specify a particular area of the country that you might want to take up position in. Okay, so you'll be able to have a list to choose from. Doesn't necessarily mean that you will get that position in that particular department. Okay, because remember, there's lots of competition, there's lots of people. There might be 50 other people who live round and about near to where you live that want to work in that particular department. Okay, doesn't necessarily mean that you won't get on the programme. If you're good enough and you get through the process, then you might be offered a place in Manchester, Newcastle, London, South. It could be anywhere. Okay, so if you really want to do it, and you're really, really keen, then you might have to prepare yourselves that you might have to move away from home, or you might have to relocate to get onto the programme. So, I've been reliably informed by the students that applied last year that some of these questions were very similar to the ones that they had last year. These are the questions from a couple of years ago that I managed to swindle out of a student that got onto the programme, so remember what the questions were. There is also an aptitude test that you have to do. Has everyone seen that? Okay. You get a chance to practice it, and you should practice it as many times as you can. I mean, I don't know how hard it is. I've never done it before. Perhaps Sam and Kent might be able to tell you. I probably wouldn't pass it myself, to be honest, but Sam and Kent will tell you a little bit more about the aptitude test. But that's a way, I think, of the national school cutting down the thousands and thousands of people that are applying to the programme to make it more manageable. Because so many people want to do it. It's a very quick way to make sure that people's aptitude is good enough to practice as a clinical scientist, but it also massively cuts down the amount of applications. Because if you don't pass that aptitude test, you can't carry on with your application. So practice it as many times as you can. Maybe read some books about aptitude tests. I don't know whether there is any, I'm sure there is. So you can get through that particular stage. So the questions, the very general questions, because obviously the questions cover all the different specialisms. So it's not directed to one particular specialism. It's a very sort of broad question. But you need to bear in mind that the answers to these questions are going to be directly looked at by potential employers. Okay, so as part of the shortlisting process, all the applications that are submitted, they get obviously separated into all the specialisms, and then they get sent off to employers in the NHS, sometimes to academic people as well to look at, and they will help shortlist for the national school. Okay, so if you're going to apply and you want to apply for cardiac science, then it's very important that when you answer your question, you try and relate it as much to cardiac science as you can. Okay, so although the question's very general, don't be too general in your answer. Okay, try and bring out what you know about that discipline and how your skills, your knowledge, your background, your experience relates to working in that discipline. Okay, because ultimately it's an employer that's going to look at it, and the employer's going to say, oh, I'd really love that person to work in my department. Now obviously they don't know who it is, and you probably won't ever get to work in that department. You might be placed somewhere else. But that's what you want the employer to think. I would like this person to work in my department. Okay? So, different questions. There will certainly be a question about your motivation, so why you want to do it, why you want to get on the programme, and try not to answer it. A lot of people do this. Don't say that I had a great uncle who had a heart attack 15 years ago, and I went to visit him in hospital, and since then I really love cardiac science. Okay, you need to be much more specific. Okay, so why do you want to be a scientist? How can you affect the future of the NHS, which is hanging by a thread at the minute, so you're going to have to be pretty good. Okay, so don't just think about simple things about observing someone being ill and then coming in to a hospital and seeing what people do. Really narrow it down to how you can affect the NHS in the future. What can you bring to a department? What can you make different? Why do you want to do that? You only get 200 words, so you have to be really sort of brief. Okay, so don't waffle on for ages about one particular thing that's perhaps not important and then not leave enough space to answer the question properly. There probably will be a question about your passion for science and technology. So what do you know about science? And to be honest, whatever discipline you're going to go for, if you've read a little bit of literature about that discipline, so I don't know, perhaps look at a journal, look at some novel articles that have been done in that particular discipline, and you can mention that and why you're interested in that, how that interacts with the role, how that could potentially change the future of that particular discipline, then that's bringing out the fact that you know about the literature, you've looked around, you know what the main journals are in that particular discipline, you know about science, and you know how that relates to your particular area of interest. Okay, so Again, you're being very specific. And to be honest, I think you can, if you're direct entry, you can apply for 2 specialisms, is that right? If you're applying for 2 different specialisms, it's very difficult to fill in this application form and sort of narrow it down to 2 different areas. So it's common sense that if you're going to apply for 2, that you apply for 2 that are very sort of closely related. So either cardiovascular, cardiorespiratory, things that are very closely related. So when you give your answer, then you can sort of write your answer and relate it to both of those particular disciplines. Yeah? So don't apply for, say, cardiac and medical physics, or you could if you wanted to, but you will find it very difficult to answer the questions in 200 words and base it on both those different disciplines. Okay? If you're in service, you can only do whatever discipline you're working in now, so you can't change from respiratory to vascular or anything like that. In service just has to do what they're doing at the moment. So values and behaviours. So hands up if you've read the NHS Constitution. Nowhere near as many people that's been on the National School website. You need to read it. Okay? Ultimately, everything that we're doing as a scientist, even if you don't even see a patient as part of your job, there's a patient there at the end of the day. Okay, so read the NHS Constitution, why it's important, why the patient is important. When you go to interviews, it's likely there'll be patients, lay representatives on the interview panels. Okay, so they're going to be very keen for you to understand and bring out, working with a patient, how you communicate with a patient, why the patient's important, why it's important to be accurate in your job, why is it important to behave morally as part of your role. Okay, so NHS Constitution will be very helpful for that. Team working and leadership. Okay, these are all sort of common things you see on most job application forms, but try and bring out when you've worked as a team, why it's important to work as a team, and we're running out of time. Right, okay, I'll be quick. Anything you've done that might be related to leadership, because ultimately, as a scientist, you will be working as part of a team, but we want these scientists to be leaders of the future. And obviously, your knowledge of healthcare science and the training programme. So you've been here, you'll know about the programme, you'll understand the programme, you'll have been and done work experience in the department, so you know what a healthcare scientist does. We're nearly finished. So, very briefly what we're looking for, the correct entry qualifications, aptitude, understands your discipline, understands what a healthcare scientist does, potentially could be a leader, a researcher, an innovator, understands the NHS and the NHS Constitution, and is able to work as part of a team. So the interviews will be held in Birmingham, usually between March and May. There's a big list on the school website of what you need to do, what you need to bring, so make sure you read it and you check it. If you are shortlisted, you're guaranteed an interview. They have this scheme where that if you get through, then you are guaranteed an interview. Obviously, if you can't go on that particular date, then you probably won't get one. I don't think they're very flexible in rearranging these things. So you might have to make sure you're free between March and May. Don't go on holiday or anything like that. I'll talk about the format in a minute. You will be interviewed by perhaps academic staff, certainly by practicing clinical scientists, heads of departments, training managers in departments, and patients as well. Okay, so there'll be a variety of people that you'll be interviewed by. You'll get your outcome on that oral system. It will send you a message on there to say whether you've been successful or not. So, questions at the interview. They're likely to be related to aptitude for science. There's always some sort of sciencey type question. Specialism-specific questions, so related to whatever discipline or disciplines that you're interested in, your values, your behaviour, and leadership and management. So all the sort of same things that you would fill in on your application form in the first place. Okay. The interviews are a bit weird. Has anyone ever been before? Not many. Okay. So almost like a bit of like a speed dating type situation. So there are 4 stations that you have to go through. And you get an allocated time. I think it's 10 minutes for each station. And the different stations will have different sort of topics that they will ask questions about. Okay. So those 4 topics that I mentioned before will be spread over the 4 tables. There'll be 2 people on each table asking you the questions. You'll obviously get time to answer them. Then, when you've had your 10 minutes, you will sit at a chair, wait for 2 minutes, and then you move on to the next station. It goes around the 4 stations. There's usually 2 streams going at any one time, so you basically sit opposite the people who are on the opposite stream. All this is on the website, on the school website, so make sure you read it. That's it. So, good luck.
Hello, so my name's Kent and this is Sam. So we're just going to cover some of the things that we thought we'd like to have known before we applied. As it says, what you're going to be letting yourselves in for, basically. So in terms of background, Sam did the practitioner training programme, which was the undergrad kind of version for cardiac physiology, and I came through biomedical science at MMU. So this is something that I think has definitely helped in terms of my application and going through the training process, because the STP covers not just your own specialism but kind of a general idea of the whole healthcare system. So when we've been into labs doing microbiology or haematology, it's definitely something I've felt a bit more comfortable with. It's also helped with my kind of biological science knowledge for some of the exams we've done. So yeah, it's definitely something that helps. If you come from a different background, don't feel that you're in any worse position than anybody else. So, So, pre-application, it's really important that you research your specialism. Speak to current STP students and see what they think about what they're doing. What is it that gets them out of bed in the morning? It is really important because it's a long commitment. It's 3 years that you're going to be doing it, so don't, just choose something that comes on the list, whatever's first, choose them randomly. Arrange shadowing placements and work experience in more than one specialism so that you know the day-to-day role and see what it is that you genuinely enjoy about it. And choose something you love, because it is, like I said, a really big commitment. It may be something completely different to the idea you previously had about each specialism. So it's good, definitely, to have a placement or work experience. It's something that I did, and without it, I don't think I would have got on. And once you've done that as well, you can then focus on, like Martin was saying, the specialism that you're more interested in, because it is hard to cross between the two. I did it the first time I applied, didn't work. The second time did work, so definitely helps. The next big thing is choosing your location. So you need to know which centre offers your chosen specialism. Not every hospital offers every specialism the STP does. You then need to know how many places are available at each centre. So if you've got, say, 10 spaces in the back and beyond and 1 space in London, one's going to be a lot harder to get into than the other. So make sure that you choose kind of strategically on what you think is going to be more competitive to improve your chances, really. Then the kind of big differences are the kind of hospitals you're in, whether it's tertiary or district generals. So kind of tertiary hospitals might offer more services and things that might kind of interest you more. We offer electrophysiology, which wouldn't really be offered at a smaller district general hospital. So that's something you could be involved in and might be able to progress onto later in your career. Whereas a district general might be smaller, but you may be trained a bit quicker because there's less staff. So it just depends what your preference is, really. I'd say definitely inquire about the locations of your rotations. So in ours, in physiological sciences, you have to rotate 3 times. So, for example, here, the MRI, they don't offer sleep services, so their students have had to travel to us in Wythenshawe to do that rotation. So make sure you're completely happy with the fact you'll be travelling for 3 months over to a different hospital. Again, it depends what hospital offers what. And visit your chosen department. This is an opportunity to kind of get your foot in the door, get to know some people and see if it's a department you're happy with working in for the next 3 years. And just be completely happy with the city you're going to be living in. Don't move to the north of Scotland if you really love London, because it doesn't matter how much you enjoy the course, it's definitely going to be difficult. So, application process. This is obviously some of the stuff that Martin's already covered. But we definitely advise giving yourself enough time to complete the form. Self-explanatory, but there's a lot to cover. It's a long, drawn-out thing. A lot of evidence is needed. There's a lot of tick boxes, so give yourself more than enough time. Some of the things that could take time, you need 2 statements from different references, so it could take a while getting back into contact with old teachers that you've not spoke to for years. Once you've gone through that, you then come to those 5 short answer questions that Martin was on about. So I won't really cover that. Online logic and numerical aptitude test. I think this is similar to the kind of UK CAT test for med school, because there's a numerical one and then there's the abstract reasoning, shapes, that kind of thing. This is definitely, for me, and I think for everybody, the hardest thing out of the whole application process. It's definitely hard. So use the practice questions, but do not rely on them as what you will be doing it in the actual test. They're quite different.
Even
Be
if
aware
you're in
of that.
service, you have to do it. I
Yeah.
couldn't even get out of it, so I still had to do it. So even if you're in service, you still got to go through the whole application process. Yeah, I definitely went on the practice questions. I did the practice questions, got through, and then it went straight onto the test, and I was like, quick, like trying to like figure out maths, and I didn't have a calculator, so be prepared before you actually start it and you know what you're doing. And the practice questions, like you said, they're quite easy in
Not quite
comparison to
representative.
what you go against when you go to do it. So just be aware
Be
of
on
that.
your toes, definitely. Next thing then is the interview. So as Martin again was saying, there's 4 10-minute stations. One is on subject knowledge, so that's where it kind of ties into the whole work experience thing, because you will pick up subject knowledge from that, and then you've got something to say if they ask a specific question. You know, if you've just chosen something for your second choice that you've got no background knowledge on, you're going to look silly really if they ask you any knowledge that you don't have.
Yeah, definitely know the NHS Constitution like inside out, because that is literally the whole values and behaviour station. And then this general science station is literally anything. I think me and Kent, do we have the same questions? One about Mars, and then one about cat's eyes. And
Yeah,
things, and then,
reflection of cat's eyes. Another one was
something about
remember. Picking an
generic-
elephant up with balloons.
yeah,
that
with
kind of thing.
balloons. Yeah. So just be wary that you could be asked literally anything on that station, especially if you start on it like I did. So everybody starts on a specific station, and I started on the general science, so not even the one that it was going to be the worst one for me. And they asked me about elephants and balloons, and then just threw me off for the rest of it. So just be wary that they can ask you anything for that.
So the structure of the programme, it's going to split into 3 main bits. You've got the MSc side, which is part-time over the 3 years. There's the online learning and assessment tool, OLAP, which Sam will cover a bit more in a minute. So this involves case-based discussions, direct observations of practical skills, and observed clinical events. And then the best bit really, which is the practical experience side of the job. This is the bit that will involve you in that kind of clinical practice, the day-to-day role, and it's the bit that you're here for really. It's really rewarding seeing yourself become a bit more independent as time goes on and see that you become a valuable member of the team from the start, where you're kind of just watching people, that sort of thing. And you also have, then there's the final exam. So this is the OSFA, and it's basically the decision on whether you are safe to practice and whether you pass the STP or not. Do we cover this a bit more in a minute?
Yeah, no. Basically, it's the final end exam. Me and Kent actually haven't done it yet. So two of the STPs in the 3rd year above us are doing their mocks in the next few weeks. And so basically, it's just a bit of an exam, and you go through a set of stations. They could be managerial questions to the diagnostics that you generally perform day to day. You could literally get anything or each one, and it's kind of I wouldn't say there can be patient stations as well, so you have to interact with the patients. It's just basically it's just a general exam at the end, just to see if you basically based out what you've learnt for the last 3 years or so.
To see if it's...
So I don't think it's easy, but if you've done the whole 3 years and you've practiced everything, then there shouldn't be any reason why.
And you do
should be
get a
worried.
mock, so that's definitely going to be valuable. Then there's the elective placement, which Sam is going to cover in a minute, and that's obviously something a lot of people look forward to because you can go anywhere in the world. So the MSc part, as I was saying, it's over 3 years. So I think it depends on the specialism, how the structure is, whether you're going on day release for some things. I think maybe vascular do. But for us, it was 6 weeks in September, October kind of time, followed by followed by an exam in the January, and then again in the May and June time. And then in 2nd and 3rd year, you get about 3 to 4 weeks, again at about September, October time. And then your project kind of starts about now. We're just about to hand in our project proposals at the end of the month, and then the final hand-in is on March of your 3rd year. So you kind of just general, I think getting everybody up to speed for the first one with like general biological science, that kind of thing.
Is it me? Right. So I'm going to talk a bit about OLAP. As we can see, as Kent put it nicely, it's basically our new best friend half the time. It's basically the online system. So as we say, we've got the three sections of it. So you've got your MSc, your OLAT, and then you've got the job bit. Your OLAT's all online. As you can see here, this is like one of the front pages that you get as you log on. So if you do get through the application process and you become an STP, this is quite overwhelming to start off with. As you can see at the top, you've got your assessments, competency log and reflective log. Don't worry about the 2 bits at the end, really. So your assessments, obviously, on the next slide I can tell you more about them, but they're made up of what Kent said, your case-based discussions and your observed clinical examinations, etc., things like that. Then also you've got your competencies. Competencies, when me and Kent first started in our first year, we looked on it and then we saw, how many did we see, like 60?
I think 60
We saw
in
60
first year.
and we were like, it just was a bit overwhelming, but we manage it well now with, you do 2 a week or something like that, and you just get them out of the way, and then suddenly you start to get these blue bars going blue all the way again because you see your progress coming along nicely. But don't forget about, we kind of forget about our reflective log sometimes. So, because when you're on the STP, you get loads of opportunities, loads of experiences to see different things. Like I've been to A&E, I've been on the ambulance, been paramedics. I've not just been in cardiology all the time, and that's been quite good for me because I'm in service. So for the last 3 years, I've been working solidly, and then now I'm on the STP. I get to see a bit of everything, get out of work for a bit and go and see other bits in the department. So it's good to keep on top of the reflective log as well, because, reflection, we all think it's a bit slow sometimes, but actually reflecting on your experiences and things, you actually do learn a fair bit from it. So this is all your OLAT, and when you come to it in your first year, you can look at the trainee video guides, and they just kind of shows what you need to do for each one. On my next slide, I've just basically said the same thing on here, so I won't go too much about it. But obviously in your first year, you have 3 rotations. So for example, me and Kent, we do cardiology, but our other 2 rotations are vascular and sleep and respiratory science. So we also have to do a few competencies in that as well in our first year. Obviously each year, you have to do your first year competencies within that first year, second year competencies within that year as well. So you need to keep on top of it. And then you also get a load of professional practice competencies as well, which are a range of competencies from present something at a national meeting, or what else can it range from, do an audit, and it just gets you involved more with understanding the NHS and understanding streamlining of services and things like that. So it's not only just a matter of what is cardiology, it's more of a let's get you involved with what is the NHS and the organisation of it as well. Like I said, it takes time to grasp what is expected of you. It's good when you first start to get involved with your training officer, ask them what they want from each competency, because it's quite hard to, you don't want to go overboard and competency, spend too much time on it, because you have got a fair bit to do, but you don't want to do not enough so you don't learn enough, or they're just going to send them back to you. So when you send a competency off, your training officer will read it, and then they'll say whether it's good enough, and they'll submit it, and they say it's satisfactory, or they can send it back to you and say, you need to add this, X, Y, Z. And yeah, it all needs to be completed by the time you've got to your, is it June, July, of your 3rd year?
Yeah.
So this is one bit of it we wanted to, it's not all work. You do get a bit of time to go on elective placement as well, which is similar to what they do in medicine, kind of. And the aim of the elective is to facilitate a wider experience of healthcare in a cultural or clinical setting that is different from the usual STP, NHS kind of training. So we know people that you can literally go anywhere. It can be, down the road to Timbuktu. It really doesn't matter. So our friend went to Sri Lanka.
Yeah, got Sri Lanka, Canada. Some
LA.
people went to Sierra Leone during the Ebola crisis to kind of work with their teams there.
And it's just an opportunity for you to, if you in your first year you find something really engaging and there's something that you particularly are interested in, you can then go see that somewhere else, or you could literally go see another healthcare system. I'm thinking of, what are you thinking of, going to Canada?
Mm-hmm.
I'd like to go somewhere really weird, or go to like Alaska or somewhere, but you've got to find the contacts in the first place. And the other thing is you've got to fund it yourself. And so obviously you've got to fund a 4 to 6 week placement, so save some money as well. I think there is opportunities to get
certain trusts, I think, which give some kind of bursaries and things, but again, it's like there's an application for that and they're really competitive, so it's quite hard to get that.
Yeah. But either way, great experience. We've not done ours yet, but we're really looking forward to doing ours. That link on the bottom just gives a fair few ideas of what people have done, so you can see what they've done as well. So we thought we'd just do a standard week for what me and Kent kind of do. In our first year, we spend 1 day in our own specialism, and then we spent 3 days on rotation in vascular for 3 months, and then we spent 1 day in our own specialism, and then 3 days in respiratory, and that was like 3 months rotations, and we get 1 day of study each week. So that 1 day of study is, as much as you're grateful for it, it doesn't cover half of what you need to do, so you're going to have to do a fair bit of outside extracurricular stuff, especially with your assignments and all the competencies that you need to crack on with. And obviously extra reading as well, because some of you guys, you know, so for example, Kent came in, you know a fair bit about cardiology, but you felt like you had to do a fair bit more of reading.
Yeah, definitely.
Yeah.
I was definitely nowhere near like the level I'd want to be. It's taken a while to get there.
And then obviously in secondary you start to specialise a bit more about cardiology, for example, if you're in cardiology or clinical bioinformatics, and then you get more involved, don't you, with the department and the team, and you're not moving about so much and you feel a bit more involved. And then you still get your 1 day of study. And like me and Kent are doing now, we're starting our projects, well, the proposals anyway, and then hopefully once we get through our ethical processes and things, then we can start performing our projects. And we're thinking about organising our elective. So as you can see, as the years go on, it does get there's a bit more to do. Okay, and then in your 3rd year, obviously you're doing your project, and hopefully you've done your elective, and it's just starting to all come together nicely. Here's I'm just going to go through these. It's obvious what you probably all of you have probably done a master's. If not, some of you might have even done a PhD. I know people that are on this programme have done PhDs, so it's all a bit obvious this, but basically, when you first come to it, make sure that you organise your rotations. They're not always organised for you. So as soon as you get there, get them done, get them sorted, so that when you come to your exam at the end, you then have done them all and you kind of know where you're up to. Start your competence as soon as possible. I know me and Kent started, and we had 6 weeks where we were at uni. We had a fair bit of stuff to learn and cover, but we had free time as well to do our competencies and start them, get them going, but we kind of
maybe didn't make the most of that. So
we
that's
didn't
our
make most.
tip.
It's a
Definitely
quiet
make the
period.
most of it.
Get going, and then obviously meet with your training officer at the start just to see what they're expecting of you, which is just quite nice, and get familiar with them. Just some final points. Like I said, you will feel overwhelmed to start off with, but then it starts to become like normal day-to-day life. Is not feeling stressed as such, but just used to the fact that you've got so much to do, and you just have to organise it and get used to it. If you know any other SCPs, definitely get experience with it, understand what their experiences are, and if you're the only one in that department, find other people, especially when you start at uni. Everyone's in the same boat, so just like we said, we've all been there. You just have to get used to the fact that you are going to be at work and you're going to have to do a master's at the same time. It's really not that easy, but you as long as you're organised, it's all fine. And like, Kent put this on there about watching Jeremy Kyle, but
there's no time for
I didn't do that, but
at all.
you definitely. And that's it, really. If you've got any questions, feel free to ask us. I think we're going to be with Martin in a bit anyway, if you're cardiovascular sciences and things. Feel free to email us. And me and Kent are part of the North West Healthcare Science Training Network Board, so if you only are starting at Manchester and you're going to be on the STP here, then we'll be on that, and so if you ever need to email us about anything, then we can help out with that.